A warm welcome to you all, dear wonderful learners, on Dr. Reena's Physiology, which is definitely going to be core, conceptual, integrated. Before I start the lecture, which we are going to take as a part of ECG, and today I'm going to take something that is called as sinus arrhythmia. Sinus arrhythmia is very important topic for your practical viva, for your experimental human physiology practical on ECG, as a 2 marks BAQ on sinus arrhythmia, or you can get a short note over it. Please, if you really think that the channel is going to be helpful, do like, share, comment. This is my Telegram group, that is Physiology Synapse to Success, wherein I provide free notes for whatever lectures I give. Okay, so let's get started. Now, you know that when the heart is functioning normally, you have got the sinoatrial node as the pacemaker of the heart, and we called it as a primary pacemaker of the heart because of its automatic firing that exceeds other pacemakers. The firing is between 60 to 100 per minute, and it does not allow any other part of the conducting system to generate its impulse. So the whole sole responsibility of generating the rhythm, generating the beat, is by the sinus node, which is the pacemaker, and because it does not allow any other tissue or any other conducting tissue to generate its rhythm, this phenomenon is also called as override suppression. So you must just remember that it has got specialized P cells, that is the pacemaker cells, and apart from this there is pacemaker potential or the pre-potential, that is because of the funny channels that are much more permeable to sodium. So sinus node, the pacemaker of the heart. Now what is happening over here? Can you see this? That when we are inspiring, the heart rate is increased, and when we are expiring, the heart rate is decreased. So this is nothing but this is today's discussion topic, that is sinus arrhythmias. So this is what is sinus arrhythmia, that is increase in the heart rate in inspiration while a decrease in the heart rate in expiration. Now, something very important. In sinus arrhythmia, the pacemaker of the cells, that is the SA node, they fire irregularly. So once I use the term irregular, don't think that it is pathological. Why it is irregular? Because the heartbeats that are produced by the SA node, they are varying in inspiration and expiration. The cardiac rate, however, is going to be within normal limits, but the rhythm can be irregular because it is responding with the cardiac cycle. So it is a very physiological phenomenon, which is very distinguishingly present or conspicuously present when there is a deep inspiration. So you can really appreciate this when there is a deep inspiration. It can naturally occur in the athletes as well as in children. So what is the cause of this sinus arrhythmia? Now see, there are various reasons given for sinus arrhythmia, right? As a first prof, it may not be possible for you to remember each and everything, but as a teacher, it is my duty to let you know the different, causes of sinus arrhythmia, so that if you want to write even a good big question on it, you can write over it. So the first important cause of sinus arrhythmia is that during inspiration, so there is an increase in heart in inspiration. So what happens is that during inspiration there is irradiation of the nerve impulses, right? There is irradiation of the nerve impulses from the respiratory center to the cardiovascular center. You know that these centers are present nearby in the medulla. So with deep inspiration, there is irradiation of impulses from the respiratory center to the cardiovascular center. This is also called as a central irradiation. Okay, it is also called as a central irradiation, and because of this there is an increase in heart rate during inspiration. Now during expiration you will not get such central irradiation, so the heart rate will decrease, right? So first important reason is the central irradiation. Secondly, you know that when there is deep inspiration, there is an increase in the venous return to the heart. That means there is an increase in the right atrium filling, and this is going to increase the heart rate via the vein bridge reflex. We've studied this in CBS also, that when there is increase in the venous return to the heart, what happens? The increased heart rate occurs. That is through the vein bridge reflex, with increase in the stretching of the right atrium and the stretching of the SA node. In expiration, definitely vice versa will be there. Another important reason, which is that during inspiration there is stretching of the receptors in the lungs or the lung airways. So there is stretching of the receptors in the airways, and because of this there is an increase in the neural discharge. There is an increase in the neural discharge, that is via the vagal afferents which supply the lung airways. So this inhibits the cardiovascular center. Okay, so this reflexly inhibits the cardio inhibitory center. This reflexly inhibits the cardio inhibitory center, and you know that when the cardio inhibitory center will be inhibited, what will happen? There will be increase in the heart rates. So during inspiration, with stretching of the receptors in the airways, increase in the neural discharge through the vagal afferents which inhibit the cardio inhibitory center, and once the cardio inhibitory center is inhibited, definitely there is going to be increase in the heart rate. Apart from this, one another reason which you can remember is that during inspiration there is a comparatively decrease in the left ventricular output. Why this occurs? Because the blood is held back in the lung vessels. Okay, so because the blood is held back in the expanded lung vessels, momentarily the left ventricular output decreases. So if the left ventricular output decreases, this is going to decrease the blood pressure, and if the blood pressure decreases through the baroreceptor reflex, okay, through the baroreceptor reflex, you're going to bring about an increase in the heart rate. So don't get confused. When the blood pressure increases, there is firing of the baroreceptors and decrease in the heart rate. But here, because the left ventricular output is decreased, a decrease in the blood pressure momentarily will decrease the rate of discharge of the baroreceptors, which will be interpreted as increase in the sympathetic activity, so increase in the heart rate. So these are the 4 reasons which are there for sinus arrhythmia in detail. But if you want to really cut short and you want to write it, ma'am thoda sa chota sa batao, so you can remember that sinus arrhythmia is nothing but it is the normal heart response to respiration, that is mainly because of an inhibition of the reflex vagal activity or tone. So when there is an inhibition of the vagus, obviously heart rate will increase. During inspiration, the increase in the flow of blood back to the heart reduces the vagal tone, which increases the heart rate, because vagus has got an inhibitory effect. So when you are decreasing the vagus, definitely the heart rate will increase. You can see that the ECG complexes, they will come closer. During inspiration, there will be shortening of the PP interval, that is the time elapsed between the 2 P waves. During expiration, the venous return decreases, which in turn increases the vagal tone. So increase in the vagal tone means slowing down of the heart rate, which can be seen in the ECG as lengthening of the PP interval, right? So how to identify sinus arrhythmia? You can see that there is an irregularity. Can we see? There is an irregularity in the rhythm. During inspiration, the PP waves, or the difference between the 2 P waves, or the difference between the 2 R wave is decreasing because the heart rate is increasing. And during expiration, you can see that the interval is widened. So an irregular rhythm, which is mainly going according to the respiratory cycle, but every QRS complex will be preceded by the P wave. So there is no problem in other waves. Okay, so remember that the atrial and the ventricular rates are within normal limits. but they vary with respiration, that is faster with inspiration and slow with expiration. So don't confuse this sinus rhythm as an abnormal rhythm with any other kind of atrial or ventricular arrhythmias. Now something very important, we know that it is totally physiological. It is something which is related to respiration, which is normally can be seen and can be obtained in ECG. But there are conditions which are unrelated to respiration and they can produce sinus arrhythmia. So this can be inferior wall myocard infarction, advanced age, digoxin, morphine. These are drugs which are used on any condition where there is increase in the intracranial pressure. So this is very important where sinus arrhythmia can be pathological. Now, how to intervene this situation, or how is the management of this patient? Unless the patient is symptomatic, there is no treatment required. That means if you know that it is just going with the flow of respiration, don't intervene, don't do anything, because it is totally physiological. But if it is unrelated to respiration, then you will have to look into the underlying cause and you will have to intervene. For example, if you know that the patient is under treatment with morphine or some sedatives, then those drugs have to be discontinued. If the patient develops sinus arrhythmia immediately after digoxin, which is a cardiac inotropic drug, then this is an alarming symptom that there can be digoxin toxicity. So you need to intervene, you need to classify that whether it is physiological or pathological. So this is all for sinus arrhythmia. Next we move on to sinus bradycardia. So you can see over here the heart rate is decreased. It is characterized by a rate which is less than 60 minutes, but very importantly with a regular rhythm. Because in the sinus rhythm, the rhythm was irregular because it was varying with the respiratory system, that is with the respiration, inspiration and expiration. In sinus bradycardia, the heart rate is decreased but the regularity of the rhythm is maintained, right? So sinus bradycardia, it is usually a normal response to reduce demand for blood flow. So it is a very normal response where the demand for the blood flow is decreased. That means what you have done, the vagal stimulation has increased, the sympathetic stimulation has decreased, right? If the demand is not more, what you will do? You are going to decrease the heart rate. How did you do this? The vagal stimulation has increased and the sympathetic stimulation has decreased. As a result, the automaticity, that is the tendency of the SA node to produce the heartbeat, is decreased. So we are just decreasing the rate of impulse production by the SA node. And again, sinus bradycardia can be physiological also, right? So it is not important that every time sinus bradycardia is going to be pathological. If you look into my pulse varies between 60 to 65, but I'm absolutely normal because it is a normal phenomenon also, right? It can take place with cardiac disorders, with cardiac and non-cardiac disorders. So some very important non-cardiac disorders where you can encounter sinus bradycardia is hyperkalemia, increase intracranial pressure, hypothyroidism, hypothermia, sleep, deep relaxation. In sleep and deep relaxation, in all these conditions, the sympathetic activity is reduced. Valsalva maneuver, forced inspiration against a forced expiration against a closed glottis. For example, during passing stools, hard stools during defecation, that is Valsalva maneuver. Carotid sinus massage are important conditions, non-cardiac conditions. Remember, the sinus bradycardia can also be featured in athletes. In trained athletes, the resting vagal tone is high, right? The resting vagal tone is high, and because of this, the athletes have got a high vagal tone, so a decrease in heart rate. These questions are also asked for you in Viva when you go for pulse examination and you don't remember anything except hypertension. So please go through these cardiac and non-cardiac causes. The cardiac causes where you can get sinus bradycardia is sinoatrial disease, sinoatrial node disease, myocarditis, cardiomyopathies, myocard ischemia. Certain drugs like beta blockers, digoxin, calcium channel blockers or anti-arrhythmic drugs can also produce sinus bradycardia. So as an Indian medical graduate, at the end of this section you should be able to identify the physiological and the pathological causes of arrhythmia. Now, how to identify? Remember, when you are given an ECG strip, the most significant thing is that the rhythm is regular but the heart rate is slow. When I say that the rhythm is regular, it is not getting altered, right? There is going to be a prolonged, the difference between the two R waves can be more. So this indicates that there is bradycardia. Every P wave will be there and followed by P wave a normal QRS complex, because there is no problem in the rhythm. The only thing is the difference or the distance between the two R waves will be more, which will help you to identify that this is sinus bradycardia. What to look for? Remember, the atrial and the ventricular rhythm beats are regular. They are both at a steady rate, which is less than 60 per minute. All other characteristics are normal. Like every P wave before the QRS complex, a normal PR interval, QRS complex, T wave, QT interval, all is normal. But just the difference between or the distance between the two R waves will be more, depicting a reduced in the heart rate. Now, something very important, if the patient has got bradycardia and he is showing you with certain alarming symptoms, please ensure that you pick up those symptoms and you understand that this is the way, this is the time where treatment is to be given to the patient. These include hypotension, so bradycardia and hypotension, cool clammy skin, altered mental status, dizziness, blurring of vision, chest pain, syncope. So these are the important alarming conditions with bradycardia. One important thing is always check into ABC, that is your airway, breathing and circulation. If you find a patient who is having sinus bradycardia and you seem not to be physiological, because if the cardiac output is not sufficient, the amount of blood flow to the brain can decrease, and this what can result in even the Stokes-Adams syndrome, right? A neurogenic shock or a neurogenic syncopal attack can be there. Now, the next one is sinus tachycardia. So you can see here the heart rate is increased. So if the sinus bradycardia is the tortoise, the sinus tachycardia is the hare. It is characterized by a heart rate of more than 100 per minute. How do you identify? Again, the rhythm is regular but the beats will be more than 100 per minute, and you can nicely now differentiate that the interval or the number of boxes between the two RR wave is reduced. So बहुत typically समझ में आ रहा है, जब RR waves का जो difference था वो ज़्यादा था तो heart rate कम थी, ठीक है, और अगर भी कम हो गया तो heart rate ज़्यादा है. But again the rhythm will be regular and you will get a P wave before a QRS complex. What are the important causes? Again, you can get it in certain physiological conditions. See, you come up the stairs. What happens? Exercise, increase in heart rate, pain, stress, fever, strong emotions. They just examination fear, examination anxiety. They all cause an increase in the heart rate. Then it can be sometimes in cardiogenic shock as a compensatory mechanism, right? When the amount of blood pumped has to be more made by the heart, then due to the compensatory mechanism, the different reflexes which are activated, especially in hemorrhagic shock, you can get a cold clammy skin, right? A very low volumic pulse but fast pulse or a fast heart rate. Pericarditis, hyperthyroidism is something very important. Like you get bradycardia in hypothyroidism. Very classically, in hyperthyroidism you get tachycardia where the resting heart rate is even more than 100 per minute, and even the sleeping pulse can be up to 200, which is a very strong finding, a very important finding with hyperthyroidism. So remember, the physiological and the pathological causes, very important for Viva as well as for 2 marks BAQ and your experimental practical. You can also get sinus tachycardia in patients with like bradycardia was with calcium channel blockers, right? it was with beta blockers. Similarly, you can get sinus tachycardia with drugs like atropine, dopamine, dobutamine, epinephrine, and excess tea, coffee, alcohol, nicotine, amphetamines are also known to cause tachycardia. So in sinus tachycardia, the atrial ventricular rhythms are regular. Rate is between 100 to 60 per minute, 100 to 160 per minute. P wave is of normal size, shape. It is preceding QRS complex. Sometimes it may be increased in amplitude. So what is the take home message? You should you should remember that sinus bradycardia B, okay, sinus bradycardia B, here the heart rate is below 60 per minute, whereas sinus tachycardia T, the heart rate is more than 60 per minute. But in both of these conditions, the QRS complex is normal. The P wave is always preceded by the QRS complex. That means first there will be P wave, then there will be QRS complex, and the rhythm will always be regular, because irregularity, that is alteration with respiration, is a part of sinus arrhythmia. Another important thing, these arrhythmias are precipitated, especially tachycardia, with excess of tea, coffee, alcohol, drugs, recreational drugs, and nicotine. So advise the patient to avoid this. So this is all for this lecture. I hope you enjoyed. I hope you understood. If you, please ensure you put a comment and you let me know what else you want. So happy learning and thank you all. God bless you.